Brad Pitt's prosopagnosia explained, although his is one of the most recognizable faces in the world. Brad Pitt has a difficult time recognizing other people by face. So difficult, in fact, that he believes it may rise to the level of the neurological condition, prosopagnosia. That's what he told Esquire in 2013 and GQ in 2022. Prosopagnosia is the clinical term for an inability to recognize faces that can't be attributed to visual impairment. According to Healthline, with prosopagnosia, it's not that one cannot remember the person. Rather, it's that one cannot connect their knowledge of the person to the face that their eyes are seeing. Prosopagnosia is sometimes referred to as face blindness, although that term is somewhat misleading. Prosopagnosia isn't a visual impairment at all, but rather a dysfunction in the way the brain processes visual data. Pitt hasn't been formally diagnosed with prosopagnosia, but he believes his difficulty recognizing faces is consistent with prosopagnosia. Brad Pitt won't remember you. Even if you've had what he calls a real conversation, your face will start fading from his memory as soon as you walk away, is how Esquire put it. So many people hate me because they think I'm disrespecting them, Pitt told the outlet, but apparently it has nothing to do with respect. In fact, his difficulty recognizing faces has been the source of considerable discomfort for him over the years, per GQ. Apparently, that's common among people with prosopagnosia. As you're about to find out, what is prosopagnosia? Prosopagnosia is a form of agnosia, an inability to recognize sensory stimulus, where such disability is not attributable to issues with memory, attention, language, or unfamiliarity, via the National Institutes of Health's Stat Pearls. In prosopagnosia, a portmanteau of the Greek words for face and lack of knowledge, per the National Institute of Neurological Disorders and Stroke, that stimulus is the human face. It does not appear that Brad Pitt has actually been diagnosed with prosopagnosia, so it is impossible to say whether the difficulty he has recognizing faces is developmental versus acquired. However, whether developmental or acquired, prosopagnosia may be difficult to recognize in oneself, according to FaceBlind. That may go a long way toward explaining why Brad Pitt only began talking publicly about his difficulty recognizing faces in 2013, the year he told Esquire that he believed he might have prosopagnosia. By then, it had already been some undisclosed number of years since Pitt first read about prosopagnosia and began to suspect that his difficulty recognizing faces, which he may have been dealing with for many years, might rise to the level of a neurological deficit. In other words, it's entirely possible that Brad Pitt had been dealing with prosopagnosia for some time before he came to recognize that perhaps not everyone has as much difficulty recognizing faces as he does. In fact, he might have been dealing with the condition throughout his entire life. According to the authors of a 2018 study published in Scientific Reports, many people remain oblivious to their own developmental prosopagnosia until middle age or even older. Likewise, despite how acquired prosopagnosia tends to come on suddenly and acutely, it's not always readily apparent to those who develop it. According to FaceBlind, prosopagnosia was first identified in 1947 by German neurologist Joachim Bodemer while studying patients who'd suffered brain injuries during World War II and subsequently complained of difficulties with facial recognition in one form or another via the Atlantic. One such patient found he couldn't recognize and distinguish between other people's facial expressions. Another couldn't assemble facial features together to form a cohesive face. In the years that followed, other presentations of prosopagnosia have been identified, including an inability to recognize faces one is already familiar with, including one's own, and an inability to distinguish between new faces, i.e., the faces of people with whom one is not familiar all appear largely the same. Via the NINS, prosopagnosia is rarely diagnosed, but around 2% of the general population may experience some degree of difficulty in recognizing faces, according to prosopagnosia expert Dartmouth professor Bradley Duchesne, via the Handbook of Face Perception. To the extent prosopagnosia is underdiagnosed, it may be because many who have it may not recognize that their experience of faces is different from that of other people, per The Atlantic. What causes prosopagnosia? Societal awareness of prosopagnosia leaves something to be desired, according to Brad Pitt, who told GQ that few believe his failure to recognize faces isn't within his control. Although some level of prosopagnosia is believed to affect 1 in 50 people, per time, it has, at least until recently, been treated as something of a niche topic within neurology. with only around 100 cases ever even having been documented in medical literature only by 2013, via The Atlantic, which points out that it didn't have a name until 1947. Nevertheless, scientists believe they have pinpointed the place in the brain that's responsible for facial recognition, or the part of the brain that makes sense of the visual stimuli received by the eyes, which collectively adds up to the cognitive recognition of a face. That part of the brain is known as the fusiform gyrus, according to various imaging studies which demonstrated that this area of the brain lights up when someone is shown a picture of a face, per Science Direct. The fusiform gyrus is a fold adjacent to both the brain's occipital and temporal lobes. According to a 2020 study published in Scientific Reports, Prosopagnosia is believed to be caused by abnormalities in the right fusiform gyrus, just above the right ear, via science. Those abnormalities may be present from birth, which is known as developmental prosopagnosia. They may also develop subsequently, which is considered acquired prosopagnosia.